My name is Dr. Maria Facadio Antero. I'm one of the physicians at Conceptions, Florida. And a little bit about myself is that I was born and raised in Brazil, specifically Rio de Janeiro. And at the age of 18 years old, I came to the United States to go to college and have never looked back, and have been here in the United States now for 16 years. Went to University of Connecticut for my residency for 4 years of OBGYN, and then returned to Johns Hopkins University for my fellowship in reproductive endocrinology and infertility. I think one unique thing that I'm bringing to Conceptions is I've been through a lot of training in different places, so I have had a wide variety of experiences throughout my training, be it in different practices, practicing in public hospitals, private hospitals, as well as seeing a variety of different patients, both in a university scenario and as well as in a private practice. So that diversity really allowed me to be able to get a lot of exposure to different kinds of patients, and hopefully that will be key to my seeing patients in Conception, Florida, and bringing that to the office. My bedside manner, I think, if anything, I try as much to get down to the patient level, and be it if I'm talking to someone that has a lot of experience in the medical field, like a physician, or someone that doesn't. A lot of things that we do in infertility is very foreign to people, but it's also very patient-driven. A lot of our treatments are patient-driven, so I think if anything, my bedside manner to patients are explaining things ad nauseum and getting down to their level and making sure they understand their care and making sure they are a part of their care, and not just take for granted that they kind of know what I'm trying to convey. I think that's the most important thing, and making sure that patients do understand and do take ownership of their care by the knowledge that we physicians can provide to them. I think initially what led me to reproductive endocrinology and infertility was just the science behind it. It's the specialty that's forever growing. The technology behind it, it interests me a lot. And then ever since, it's just the patient population, I think, for me, is what drives me the most now, and what we get to do every day, and offering people the chance of building a family, people that not long ago, 20 years ago, or sometimes 15 years ago, we didn't really have the technology to allow them to have a family. And I feel like it's very gratifying to be able to do that as a physician. What excites me about joining Conceptions is that we can provide patients, when they come through the door, the whole gamut of infertility treatments, as well as infertility surgery, which I know sometimes is not the norm elsewhere, so we don't have to kind of send them back to their doctors. We can provide everything in-house to our patients, so I think that excites me the most, to get that continuity of care with our patients. I think my biggest hope, of course, for patients is to have them get pregnant and fulfill their dream, and if not, just kind of have them understand their diagnosis and understand their possibilities. Because of course I know I am a hopeful romantic, but glass half full kind of girl. I know that there are a lot of patients that are going to come through the door there are some patients that our technology's not there yet to get them pregnant, but to at least have them understand that. And sometimes it is hard, sometimes it takes a couple of kind of consultations, but I've seen that patients are very appreciative when they kind of understand, that their outcomes and their diagnosis and what it means. So I think that's my biggest hope for patients, that they understand what their diagnosis means and what care we can provide for them. A fun fact about me would be that I am a huge sports fan. I'm usually very calm and collected, but when it comes to football or Formula One racing, yeah, I'm not a very calm and collected person. Very avid, been since I've been very little, very into just sports watching in general. I'll, wake up in the middle of the night to watch any kinds of sports, but football and Formula One racing are my definitely favorites.